Good morning. We'll go ahead and start with the numbers for today. Today we have 534 new positive cases for a total of 9,703 positive cases. 85% of today's positive cases are from the 22 counties where restrictions remain in place. We had 3,441 new negative cases for a total of 47,458. I am so sorry to report that 4 more Iowans have passed away. Sadly, deaths continue to be consistently among older adults and those with underlying conditions, many of them in our long-term care facilities. The Department of Public Health has confirmed one additional long-term care facility outbreak, Acura Healthcare of Marshalltown in Marshall County. We have 57,161 total tests have been conducted in Iowa for a per capita rate of 1 in 55 Iowans have been tested. We have 3,486 Iowans that are now recovered for a recovery rate of 36%. On Friday, I updated you about a backlog in reporting case counts last week due to the high volume of tests generated from surveillance testing at long-term care facilities and manufacturing facilities and the launch of Test Iowa in Des Moines and Waterloo. And as we expected, the data entry work was caught up over the weekend and the numbers reported were higher than usual. On Saturday, we reported 757 new positive cases and 3,377 new negative cases for a total of 4,134 daily tests ran. On Sunday, we reported 528 new positive cases, 2,932 new negative cases for a total of 3,460 daily cases, for a total number of tests run last week of 17,098. There's a significant accomplishment. That's a significant accomplishment, and we're working hard to improve the timeliness of processing and reporting results so that Iowans know the results as soon as possible. And again, I want to just give a tremendous shout out to the team at the State Hygienic Lab. They are working round the clock to catch up and process the tests so we can be back on track. So just a great effort by that team at the State Hygienic Lab. Last week, I also shared that there was a delay with some of the Test Iowa results. Under normal circumstances, individuals should get their test results in approximately 72 hours. But because of the high volume of tests being processed at the State Hygienic Lab last week and the ongoing validation process for Test Iowa, we weren't able to meet the timeline, that time frame for some Iowans. I know waiting for test results is difficult, and I'm sorry for any concern that this may have caused you. I want to again reassure Iowans that this is a short-term issue as we ramp up testing and processing and complete the Test Iowa validation process, which again, that is just standard any time that a new test is introduced at a lab. I am glad to report that many of you did receive your results over the weekend, but if you were tested later last week, yours may still be on the way. So please continue to watch your email for information about your results, and until you know your test results, it's important that you stay home. By isolating yourself at home, you'll reduce the risk of potentially exposing others to the virus. And if your condition has worsened since you were tested, please call your doctor to seek medical attention or call 911 if you're having trouble breathing when you're at rest. Today, I also want to take this opportunity to recognize our heroes in public service. You may not be aware of this, but this week is Public Service Recognition Week. It's a time set aside to honor the men and women who serve our nation as federal, state, county, and local government employees. This year, it's especially fitting to recognize the employees of our state agencies, many of whom are serving on the front lines in response to the COVID-19 pandemic. Each have made significant contributions to mitigating and managing the virus and protecting the health and livelihoods of Iowans, and they have worked countless hours. From the Department of Public Health for its incredible leadership throughout this crisis, to the Department of Human Services for ensuring Iowans still have access to the services that they need, to the Department of Education for keeping students, families, and schools connected, to the Iowa National Guard and the Homeland Security and Department of Public Safety for your commitment to serving Iowans whenever and wherever it's asked of you, to the Department of Corrections and Iowa Prison Industry for stepping up to supplement Iowa's PPE supply when we needed it most, to the Department of Transportation for their role in coordinating Test Iowa sites, to the Iowa Workforce Development, the Iowa Economic Development Authority, and the Department of Revenue for helping Iowans and Iowa small businesses get back on their feet, and to all of my other agencies and my own team, a very heartfelt thank you. And also to the incredible partnerships at our local level, especially with our local public health officials, our local emergency management, and our county and city government leaders. Something of this magnitude requires an all-team effort, and Iowans can be proud knowing that those who serve you are working hard as a united front in your best interest. So to all of those in public service, again, my heartfelt gratitude for a job well done and for your continued partnerships as we begin to move forward and bring back Iowa even stronger. One great example of how state and local entities have worked together over the last several weeks is our strike teams. As you've heard, strike teams of nurses from the Department of Public Health, the Department of Human Services, and the Department of Inspection and Appeals are conducting surveillance testing among essential employees in communities or facilities where virus activity is high. By working with essential businesses to offer diagnostic and serology testing of their employees. We have an opportunity to identify and isolate positive cases, conduct case investigations to track the virus activity and to better understand the scope, which ultimately helps us contain and manage the spread. And it also provides great reassurance to the employees that their workplace is safe. This week, we'll be sending strike teams to several more long-term care and manufacturing facilities and providing testing supplies for others to test approximately 5,700 more employees to be proactive in managing activity. Once the virus is in any facility, congregate setting, or even households where many people work in close proximity or live with each other, it spreads quickly and it spreads easily. And that's what we're trying to get in front of by conducting targeted diagnostic and serology testing of employees at businesses and long-term care facilities where the stakes are high. It also, as I said, provides confidence for essential workforce, helps keep our businesses operating, and protects our most vulnerable population. This week, the Department of Human Services did confirm that a resident at the Woodward Resource Center tested positive for COVID-19. This is the first positive case at any of our DHS 6 facilities, and I've asked Director of the Department of Human Services, Director Garcia, to provide an update on the steps taken. Director Garcia?
Thank you, Governor, for having me here today. First, I want to acknowledge this highly contagious nature of COVID-19. We knew it would be a matter of when, not if, we had a confirmed positive in any of our 6 facilities. We're doing everything we can to protect our team and those we serve. 9 DHS employees who work at 5 of our 6 campuses have tested positive to date. Because of our policies, many of these employees were not on site several days before they received a positive test, and most had no client interaction. I'm happy to share that all of our team members are doing well at this time, and we continue to check in on them frequently. Additionally, as the Governor mentioned, I'm sad to report that as of today, 6 residents at the Woodward Resource Center have tested positive. A resident at Woodward Resource Center who was presumptively positive on April 25th was confirmed positive by the State Hygienic Lab on May 1st. This was the first resident to test positive at any of our facilities. And as a precaution, we tested all residents in this individual's home who were asymptomatic at the time. To protect other residents in the home, those who test positive or become symptomatic are transitioned to other houses on campus designated for positive cases. We've been working closely with IDPH, Boone County Public Health, and we've also pulled in a team of doctors for additional technical assistance from the University of Iowa. Before any confirmed cases of COVID-19 in the state of Iowa, DHS began analyzing our operations across the agency. We focus much of our preparedness and response efforts on our facilities. Throughout this pandemic, I've talked with facility leadership twice daily. Not dissimilar to long-term care facilities, our staff are in close contact with some of Iowa's most vulnerable individuals, and we have undertaken significant efforts to keep everyone safe. On March 10th, DHS provided its first COVID-19 protocols. We limited travel and we implemented prevention measures. On March 12th, we began screening visitors, and that very next day, on March 13th, we suspended in-person visitation. We knew that our existing PPE stock would not be enough, and so we ramped up efforts to find supply. Our fiscal management team has worked tirelessly over the past several weeks to ensure we have additional masks of all kinds, gowns, face shields, and other critical items. On March 15th, we began daily screenings at all of our facilities of both staff and residents for signs and symptoms of COVID-19, including temperature checks. If a resident spikes a fever or otherwise showed symptoms, they were tested. On April 1st, all Resource Center staff began wearing masks in patient areas, and effective April 25th, all staff at all facilities wear masks at all times. Our goal has been to create an environment that when staff become ill, they feel supported, they notify us, they stay home, and they seek testing. We will continue to follow strict protocols to prevent the further spread of this virus. To the residents, their guardians, and loved ones, and to my team, I want you to know that we will use every tool at our disposal to ensure you are supported through this time. And I want to send a special recognition to my team as well during Public Service Recognition Week, which now takes on a new meaning. I'm grateful to our entire team for the tremendous work they're doing. This work is challenging and often not for the faint of heart, and now more than ever, it requires compassion, humility, and courage. And I can tell you with zero hesitation that I'm seeing this every day. Many of our staff continue to serve on the front lines. I'm especially moved by our fellow team members, our nurses who have volunteered to assist the state in our testing, and our team members who have assisted in contact tracing efforts. I always tell them, if not us, then who? Team DHS is dedicated to helping Iowans in need, and even in the face of a pandemic, our team goes above and beyond. So to my team, thank you for stepping up, thank you for leaning in. And to my fellow Iowans, I ask you to join me in thanking them and thank all of your public servants in your life and essential workforce during Public Service Recognition Week. Thank you, Governor.
Thanks, Kelly. And again, I just appreciate so much all your team has done to serve Iowans throughout this really, really challenging time. And I know that there is a deep commitment to protect the health of the individuals cared for in our state's facilities. And I want to especially thank the teams there for all that they do day in and day out to protect those residents. In closing, I also want to thank the Test Iowa team. Today, our third location opens in Sioux City. This has been a tremendous effort in a short amount of time, and it's going to make a big difference for Iowans. So again, thank you for your time and effort in making our rapid statewide implementation possible. So with that, we will open it up for questions.
Governor, have any of the Test Iowa machines at the State Hygienic Lab been validated and approved for use? Are they being used to process tests? And where's the money coming from to hire the people at the Test Iowa sites to actually do the testing?
Yeah, so we have been able to run some of the Test Iowa tests through the State Hygienic Lab using some of the Test Iowa equipment and the State Hygienic Lab equipment. We're still working to validate the PCR process, so they're still working on that. They've made tremendous progress over the weekend, but we also had to allocate a lot of the time to process the backlog, so they've been able to address both, and that's what I mean. It's been just a heroic effort by everyone at the facility. So as I've said before, the Guard is the ones that is instrumental in helping us set up the Test Iowa sites, as well as Homeland Security, the Department of Transportation. We have used nurses from the Department of Human Services, and then we're contracting with some nurses that have been furloughed to use at some of the Test Iowa sites. So that's a partnership that we have with a couple of our hospitals, which has been great. And then of course we did a press conference on iServe. So there's nurses out there that just simply want to volunteer. So they've also been a part of the Test Iowa setup. And so remember, we've got CARES money coming into the state to help really pay for some of the testing capacity that we've done so we can run it through FEMA, which is a 75-25, and that encumbers everything that we're doing for the increased testing ability. That's LabCorp, that's the national labs, that's what we're doing at the State Hygienic Lab, and then Test Iowa. So some funding is, we can process some of the funding through that, 75-25. We're hoping to get it 100% funded, and then in addition to that, there's also just some specific funding through the CARES Act for testing, because they're really wanting states to ramp that up.
Governor, referencing the backlog, we've spoken to a couple of Iowans who were tested on April 25 that still haven't gotten the results back. At the Test Iowa site, how big is this backlog, and what percentage of the total Test Iowa?
Yeah, so we got about 900 to 1,000 through yesterday from the Test Iowa, and we should complete the backlog today. So then we'll be back on track. You saw the numbers from the weekend. They were really able to process a lot of the test and to get us caught up. And so then we should be in a pretty good place moving forward as we just start to continue to build out the Test Iowa sites. Again, I talked about, using other labs as well with LabCorp, and then another component of this is the serology testing that we're doing too. We're one of the few states that are doing that as part of our surveillance testing with our long-term care facilities and some of our manufacturing facilities, and that really does help, again, just address some of the individuals that were asymptomatic, didn't even know that they had it, but actually have and have recovered. And so that's a part of that, helps us really identify the scope of the virus activity in each one of the facilities and really take the steps that we need to separate those that have tested positive and negative, or were asymptomatic and tested positive through the serology testing.
Governor, we get a lot of questions, as you might guess, about Test Iowa. How can the public know when these daily reports come out, what came through a Test Iowa side, what came through others, and then also who had shown symptoms, who had not?
Yeah,
to
so
show kind of the broader picture.
Yeah, from the very, and I might let Sarah talk about this, but from the very beginning, we didn't separate out the different testing opportunities. I mean, we've been using first it was the national labs, and then we've had hospitals and that have come on board, and they're able now, once they were validated, to actually do the test and then process it right at their facility. And so Test Iowa would be no different. So we really never have broken those out. We've reported total tested positive and total tested negative, and I really don't anticipate changing that process. Do you have anything to add to that, Sarah?
The only thing that I would add is, we have health systems doing testing, we have national labs doing testing, just to the governor's point. And I can tell you, I've spoken personally with Dr. Pentella. He's not going to run equipment if he doesn't have confidence in the equipment and its performance. And so there'd be no reason to separate out Test Iowa results separate from any other test results, because the Test Iowa equipment is going through the exact same kind of validation that all of the other tests that are happening have done. And so we'll just continue to report positive test results regardless of the source as one positive number.
How will the public know whether Test Iowa is as accurate as everything else is?
Well, we do that through the validation process. And so just like they validated the State Hygienic Lab through the CDC process, then we'll use that same process to validate Test Iowa. And I have complete confidence in Dr. Pentella and the State Hygienic Lab to complete the process. They're not gonna validate it until they're, as Sarah said, until they're comfortable that it meets the criteria that it needs to meet.
When you take a strep throat test, there's a high negative, and often they run it again through a different kind of test and call you later and say, actually, you do have strep throat. Are you, the negatives, are you in any way reaching out to them and encouraging them to run it separately if, as suspected, some of these Abbott machines have a 15% false negative?
Well, Sarah, yeah, that might be just outside of my scope of expertise.
Okay, what I would say about that is if somebody's had a negative test, if they are still feeling ill, if they need to go to their doctor, they should continue to seek health care. If they continue to worsen, if they continue to be symptomatic, if you are sick and you have had a negative test, that doesn't mean that you should not seek health care. You should call your doctor's office, see if you need to be reevaluated, and every Iowan should do that all of the time if they're not feeling well.
So we spoke to, along those lines, sorry, Senator, we spoke to the family of a man who tried multiple times to get health care, tried to get tests. Eventually he was able to get a positive test for COVID, but he sadly passed away as a result. What does that say about kind of the structure that the state has set up for providing tests and the healthcare system for providing care to individuals who may have COVID?
Well, first of all, any death is heartbreaking, and I can't imagine the grief that the wife is going through. So, you know, anybody that has lost their life to COVID-19 is just horrible. But as we've said all along, if you have symptoms in your home, call your doctor. They will run through you, with you, an assessment and make the determination, the physician, the clinic, whether you should be tested or not. But like any other time that you visit the doctor, if you're not satisfied with what they tell you, if you're still feeling sick or ill, I would encourage Iowans to get a second opinion. If you believe that, you know, you have been exposed or that you are demonstrating symptoms and you go to a clinic and they don't test you, then I would encourage Iowans to get a second opinion and to continue. You know, these are like Test Iowa is a tool. It's on top of all of the other testing options that Sarah was talking about. But you know, again, just to reiterate over and over, if you're feeling sick or you're exhibiting some of the symptoms or you think that you've been exposed, then you know, call your doctor, walk through them what you're experiencing, and then they will make the decision on, you know, what you should do.
Aaron Murphy, Lee News.
Thank you, Governor. You said this morning on a conference call with other governors talking about reopening strategies that the next phase in your strategy for the state is growth. I was just hoping for some clarification on what you meant by that. Are you talking about economic growth, or are you actively considering lifting restrictions in more counties or lifting more restrictions?
No. So, you know, I talked on the call how we kind of had three phases. Stabilization was really about mitigation, and it was about resources. And so that's why, you remember, I talked about putting the RMCC into place. We wanted to, first of all, make sure that we were protecting our most vulnerable Iowans, that we were managing our resources so that we could start to flatten the curve and not overwhelm our hospital system. And today, we have over 4,000 beds available. We have over 550 ICU beds and over 650 vents. So we've been able, with the good work of Iowans, by really being responsible and doing what they've needed to do, we've been able to demonstrate, you know, not only statewide but by region, that we have the capacity to treat COVID-19 and in fact have, you know, pretty good excess of beds and vents and ICU beds across the state, which is good. And I just, unprecedented collaboration from our hospitals all across the state. I appreciate the efforts that they put into this for daily reporting so that we can have some sense of usage and discharge and where we're at as we move forward. So I appreciate that, and because of that, then we really moved from mitigation efforts into easing some of those mitigation restrictions, and we moved more into a containment and management of virus activity, and so that's where we're at right now. So that's where we started to ease some of the mitigation efforts that we put in place for Iowa's 77 counties. We still have some pretty significant protocols put in place as we start to open up restaurants and fitness centers and some of our retail outlets and elective procedures, opening up them. There's still a lot of parameters that they have to abide by in order to do that, and so we'll watch that, and we're hoping as we can use the test, the assessment, the testing, and the case investigation, we'll start to continue to watch counties and see if there's maybe additional counties that we can bring on, or maybe there's additional things that we can start to open up. But we'll do that on a daily, weekly. I think the declaration or the proclamation that I have in place right now goes through May 15th, so we're going to continue to evaluate and see what's next. In the meantime, later this week, I'll be talking about the governor's economic recovery task force, and that's really bringing individuals together to really understand the impact that COVID-19 has had on Iowans, our families, our businesses, and our state economy, looking at how we react to that and come back even better and stronger, and maybe redefine some of the ways in which we are serving Iowans through what we've learned through this pandemic, and just apply some of those strategies to really, moving from stabilization to recovery now into growth. And so we're going to put a great team together that's going to really analyze that, put some metrics in place, and talk about how we start to, after we get through the growth phase, start to open up and grow Iowa's economy.
Chris, KCCI.
Hi there. So the Tyson plant in Perry, Tyson still refuses to release numbers of infections there, and numerous local officials there in the city of Perry have called for Tyson to do so, and the Dallas County Health Department won't release the numbers either. Do you believe it's in the public interest for the public to know those numbers? Is the DPH willing to release those?
You want to talk about that? We're actually meeting this afternoon.
Hi, Chris. Thank you. Yeah, the Department of Public Health, working with our state medical director, there's a state statute that talks about her ability to release information related to names of businesses when it's in the interest of the public's health. And so we've been having those conversations in terms of what is that threshold for identifying an outbreak at a particular business. And that's actually one of the things that we'll be confirming today in terms of where we have seen outbreaks and whether it's in the public's interest for us to release the names of those businesses at this time. So I think it's actively on the to-do list for today, and we'll have more information for you in the next couple of days.
What's the criteria for saying if something is of public interest, if a business has an outbreak?
Yeah, so for businesses, it's for 10% of their workforce has been identified to be either COVID positive or has been in close contact with somebody who has identified to be positive for COVID.
Are those hard and fast?
The 10% threshold?
Yeah, are those thresholds?
Yeah, that's been the legal threshold that we've determined working with Dr. Padati to identify those businesses. And so we'll be taking a look at our information and be prepared to make that public in the next couple of days. Thank you.
Nicole.
And we have made it clear where we're doing the testing. So we've talked about the different facilities all the way through that we were actually doing some of the surveillance testing. And so we've been pretty transparent about that. And as Sarah indicated, we'll be addressing the other in the next day or two.
We've got time for 2 more questions. Nicole, KCRG.
Governor, what will the threshold be to increase restrictions on the 77 open counties? For example, 5 days ago, Wapello County in southeast Iowa had 15 cases. Today they've reported 84 cases, and they announced the first death related to the virus over the weekend, and only 8 people there have recovered. Does that rapidly growing case count concern you?
Well, we're going to continue to watch it on a daily basis, and with the testing capacity that we have, with the assessment, and then with the case investigation and the contact tracing, it really does allow us to look at some of the spike in cases, not only from a state but county to a community to even down to a zip code, so that we can start to monitor that and address it in a fairly rapid way so that we can hopefully prevent seeing a significant spike. So we're going to continue to monitor the counties across the state. Remember, as I said earlier, they still have pretty significant controls in place for businesses that are starting to open up. And what I've seen, even from businesses and restaurants and churches, they really are being very judicious and thoughtful in starting to open back up some of their businesses and churches. They just they're putting protocols in place. They want to make sure that they are giving the consumers confidence to come back into their facility. They want to make sure that they're not putting their congregation in any danger. And so what I've seen as we've started to, loosen and ease some of the restrictions is a great deal of responsibility being taken by the businesses and the entities that we've started to open up just a little bit. And I appreciate that very much. So we're going to continue to identify clusters or areas of concern. We'll do the case investigation, and that'll allow us to really figure out who's been in contact, what is the exposure rate, can we contain it, or are there additional steps that we may need to take?
Last question, David Pitt, Associated Press.
Oh, yes, Governor. Thank you for taking our questions. So on the call this morning with the other governors, where you were applauded for being among those who are taking these steps to open, I think you had to leave before the question was asked, but the other governors answered the question. I'd be interested in your response, and that is, it's a difficult, I think, track to take to open up again and balance the political pressures that you're getting to reopen the state with the data that you're reviewing and the real life implications of reopening. So how do you balance that, the politics of all of this and the pressure from the religious community perhaps and from the business community to reopen with the realities on the ground?
Well, first of all, I did answer that question before I stepped off, and I kind of had a hard stop and went 15 minutes longer than I had said I would be able to do. But this isn't political. That's one of the reasons I've been able to stand here every day and talk to Iowans about making decisions based on data and metrics, based on the expertise that I have working for the citizens of Iowa, whether that's the Department of Public Health, their incredible EPI team that's in place that are working day in and day out to really provide great information and recommendations to me in collaboration with the CDC. We've aligned very well with much of what they've asked and required and encouraged states to do across this country. They've worked with their colleagues across the state, just like I've worked with my colleagues across the state, to understand some of the steps that they've put in place, some of the mitigation steps, how they're talking about opening things back up. You know, these are some of the hardest decisions that I've had to make as a governor of this great state. We had a growing economy, our cash reserves are full, our fiscal health was strong, Iowans were doing well, our unemployment rate was low, and to have this pandemic hit the state and our country and have it impact Iowans and businesses and families in the manner that it has is heart-wrenching. To talk about the amount of deaths and the people that have lost their lives due to COVID-19 and how we manage all of that. And you just can't look at it from one isolated perspective. You have to look at the health and the well-being and the mental well-being and the livelihood of Iowans. As I said the other day, we're seeing increase in substance abuse. We're seeing additional food insecurity. We've had over 200,000 Iowans who are receiving unemployment claims. You know, we Iowans are meant to work, and we need to open back up, but we have to do it in a safe and responsible manner. So this isn't political, and it shouldn't be for anybody, and I don't believe it is. It's about trying to do the right thing in an unprecedented time to really manage the health and well-being of Iowans and their livelihood, and we're going to continue to make decisions based on great recommendations from a group of experts that I feel very confident in the information that they're providing me. So thank you.